Us today. My name is Dr. Jennifer Berkey, and I'm a clinical audiologist at the UNC Greensboro Speech and Hearing Center. We'd like to welcome you all to our presentation today on brain hearing. Joining us today, we also have Dr. Lisa Fox Thomas, who is another audiologist here and is our specialist in sound sensitivity and auditory processing and tinnitus. And we have Dr. Amy Myers, who is our other audiologist who, like me, specializes in hearing testing and hearing devices. Today, we're so glad to have Dr. Laura McCall join us. She is an audiologist and education and training specialist with Oticon. She has experience working with patients all across the age span, from pediatric ENTs to busy VA hospitals, as well as in private practice. And we're delighted that she's here today to talk with us about brain hearing. Dr. McCall.
Hey, everybody. Thanks for joining us. Just want to do a quick check. Does my mic sound okay? Everybody can hear me okay? I have some other options if this doesn't work. In this world of video conferencing, we've have a lot of options to move to. So let me know if you can't hear me. I think everyone here wanted to, just let this be pretty informal. So I'll be talking throughout and going through some slides, but if you have questions, if you've used Zoom before, there is a chat box, and I think the other audiologists will be kind of monitoring that as well. If you have questions, you can type those in and we can look at them later. If you want to unmute ever and just interrupt me, I'm okay with that if you have a question. Otherwise, we will get to the questions at the end, so you can write them down and we can answer questions at the end as well. Okay. All right. Well, thanks for joining us. I am going to talk a little bit about brain hearing and hearing health care. And I can't see everyone on my screen because of the way the Zoom's set up. So I can see some people's videos. If you want to keep them on, that's fine. You don't have to. I'm sure some of you may be experienced hearing aid users, or maybe new hearing aid users, or have never even had a hearing test. So this will kind of cover all the bases for some of you, and some of it might be a little more familiar to you than others. Here. And Jennifer, you can see my larger screen, right? Okay. Okay, so I first just want to go over a little bit about how we hear. If you've ever had a hearing test, this may have been explained to you a little bit, but just in general terms, going through our hearing and how that's connected to our brain. So I think the big picture I want you to get is that you probably know that you hear through your ears. But by the end of this, understanding how your brain is really the processor of that signal and how that's really important for a lot of reasons, and understanding if you have a hearing loss, how to best aid that hearing loss and what to do if you've been diagnosed with a hearing loss. So your hearing is really a system. So again, you have your two ears that pick up the sound from the environment. And then that is sent up to your brain. So the ears receive the sound, but the brain is really what helps make sense of that sound, helps orient in your environment, and kind of help you pick out what is speech and what is noise in that environment. So sometimes when there is hearing loss that happens, that can kind of make that system a little more difficult to work like it used to. So that's when you start noticing, okay, I'm hearing sounds, but maybe I'm not understanding as well. So we really want to make sure what we're doing to help aid that hearing loss is really helping to support your brain to make sense of the sound around you. So again, two ears and your brain work together. The reason you have two ears is to help locate sounds in the environment, help you understand where sounds are coming from. So if you happen to know anyone that has hearing loss in one ear, if you've ever experienced hearing loss in one ear and have hearing that's better in another ear, you may have noticed that it's really hard to tell where sounds are coming from when that happens. So that's just something to keep in mind. If you do have a hearing loss and it is in both ears, you've probably been told, or maybe you will be told if you get a hearing test, that hearing aids in both ears is typically the best recommendation, because making sure both ears are aided really well and getting access to sound on both sides is important to help you orient in your environment as well. And again, get the brain the information that you need there. This is a quick video. If I can get it to play here, I may have to move this around, just to show a little bit about the system itself. So again, that hearing coming in through your ears, and this just gives a little peek into the ear canal. What we look at when we look through that otoscope, your eardrum, sound goes through your eardrum, moves some bones around in that middle ear, causes some fluid to move in there, and then sends some neural signals. Oh, you guys can hear that. Send some neural signals up to the brain. So those sounds are sent to the brain, and then your brain is actually turning those sounds into meaning for you. So again, it's important for us to get the sound to your ear at an appropriate level, but making sure that what we get to your brain is really a clear picture so that your brain can access and use that sound well. And this, whenever that if you've worn hearing aids before, or if you have a hearing loss, or if you've ever been in a situation where you're having trouble understanding, this is where that comes into play when you hear a sound, but maybe you're not understanding it well. Okay, so this is a lot of research kind of bundled up into a few slides here, just to kind of go over it very simply. Your brain, this is kind of shows how your brain makes sense of sound. So the brain really, based on some research, has a few different parts of your brain. The auditory cortex is really what is being activated when you're hearing sounds. And there's been a lot of research that shows there's two different subsystems of that auditory cortex. And one is going to be the orient subsystem. And that really helps you scan the environment and take in all the information around you and help create kind of an overview of what's around you and a picture of your environment around you. And then you have your focus subsystem. And that is really the part of that system, or that auditory cortex, that helps you pick out the speech and focus in on what you want to hear in that information, in that signal. So a lot of times you may be in situations where you're hearing a lot of conversations, but there may be something that you really want to focus on, or you're kind of listening to one conversation, but you hear something over here, you want to focus on something else. And that's really important to be able to do, because that's how our brains hear naturally. We want to be able to be aware of sounds around us, for reasons of safety, knowing that there's, a car over here, or maybe some kids on the playground over here you want to be aware of, but you're also trying to listen to a conversation. So your brain allows you, your orient subsystem, to know all those things are there. And then your focus subsystem kind of focuses in to help you pick out the important things and what your brain chooses to listen to in that situation. And usually when there's hearing loss, sometimes that system can be a little, it's more difficult for you to be able to do that. So sometimes you may hear those sounds, but it's hard to make sense of them and actually get a focus in on what you want to hear. And it's really important when you do focus and when you're able to do that, that means you're able to clearly more recognize those speech signals that you want to hear. And that is often sometimes, if you do have hearing loss or you wear hearing aids, maybe something that you feel like you could struggle with at times. And again, as an audiologist, we're here to test your hearing, make recommendations for hearing aids, or recommendations for other reasons to go maybe see another medical professional if you have a hearing loss. But really in the bigger picture, there are many reasons for that, because we really believe that hearing care is part of your health care. And there's a lot of research that you may have been aware of in the last few years that really kind of support that hearing loss is really important to take note of and to kind of make sure you're addressing if it's there. One little fun fact is that hearing loss is the third largest public health issue in America. It's the second most common health issue in the world. And about 40 million, that'll show on here, 40 million Americans are diagnosed or have hearing loss. So sometimes those are hearing losses they're born with, but there are also some lifestyle and conditions across your lifespan that can affect your hearing. So if you've been working in an environment that's really loud, if you've had surgeries, things like that, there are some things that can also cause those hearing losses. So it's a pretty big health issue in the world and the United States. So a reason we really think that we kind of talk about hearing care as health care is because it has been linked to a lot of other health conditions. So hearing loss has been linked to things such as diabetes, kidney disease. This kind of slide will show a little bit more about evidence that we've seen that untreated hearing loss, we kind of have hearing loss here in the middle. If it's untreated, can really kind of link to other issues. So when you have hearing loss and you withdraw from situations, for example, sometimes that can lead, if you're not socially interacting with those around you, sometimes that can lead to depression. There was also a really big journal that was published a few years ago, kind of linking hearing loss and the way that it can be a modifiable risk factor for dementia. So there were some studies done with patients that had hearing loss, and some things that patients that did aid their hearing loss and shown that their risk of dementia did decrease there. So this slide just kind of shows a lot of other things that can be linked to untreated hearing loss. So we really feel like, if you have a hearing loss that's been diagnosed, or if you feel like you're not hearing well, this is a good reason just to come in and get a quick check and see where that hearing may be. So the Lancet study that's the study that was showing those dementia risk factors. What they kind of separated out were potentially modifiable risk factors and non-modifiable risk factors for dementia. And what we really want to focus on are those modifiable risk factors, because those are things that possibly if you can control those things through good health care, that maybe you're reversing some of your risk for possible dementia in the long run. So this study really showed that about 40% of these risk factors are modifiable. Some of them were managing hearing loss, depression, diabetes, hypertension, things like that you can see a medical professional for and get treatment. And those can reduce your risk for dementia. Again, some of those risk factors are non-modifiable. So those are things that, throughout your lifespan, maybe things you were born with, genetic dispositions for dementia, but a 40% modifiable risk factor is really pretty large there. And I really like this, kind of takes a little bit to kind of orient and look at it. But it does kind of in the pink line show where hearing loss is in this kind of lifespan here. So some of the things that they saw as risk factors for dementia are unexplained reasons that they really again, genetics, maybe someone that was perfectly healthy that developed dementia, those things that they were not able to explain that were risk factors. But you can see that early life, one of the things was less education. As you get into midlife, some things that were modifiable here, hearing loss is 8%. So that's pretty large compared to the others. Brain injury, hypertension, they did out alcohol in there, I think last year in a newer updated part of the study, obesity. And then later in life, some other risk factors that you can potentially modify: smoking, depression, social isolation. And as I mentioned earlier, sometimes hearing loss in addition can also lead to social isolation if you're not aiding your hearing loss and maybe considering, well, I'm not going to go to that event because I'm not hearing well. So you can see how these are a little bit intertwined as well. Leave that up for just a second. I think this is really nice to see, but really just noting that hearing loss is the #1 greatest at 8% modifiable risk factor for developing dementia. And this is even at mild levels. So maybe you're thinking, if you've had a hearing test and you've been told, your hearing loss is mild, moderate, severe, there's a few different levels of hearing loss, that even at a mild level, it is something that can be really a risk factor for dementia there. My slides got ahead of me there. Okay, so again, back to that social withdrawing from social interactions. If you have a hearing loss, maybe, or someone with a hearing loss, maybe you have noticed this, but this is something we do see with patients that have been diagnosed with a hearing loss because they have chose to not go to events or interact with those around them as much because they were not able to hear well. So I'm sure you can all think of a time maybe where you've been in a situation where it's been really difficult to hear, and you kind of just said, well, maybe this wasn't worth coming, or someone that has mentioned that to you. But we know that those withdrawing from those social interactions are can be really risky to your overall health and social well-being as well. So spoken language really should be easy to hear. So maybe when you were, if you do have hearing loss and you remember back to the time when you did not have hearing loss, if you had good hearing, it was pretty easy to hear those around you, and that should be effortless. When you start to notice that it is difficult to hear, you're probably right. It's probably, sometimes you may have others telling you first, like, oh, are you hearing me well? Or if you've ever had a time when you've had, your ears are stopped up from having a sinus infection or something like that, you notice immediately, oh, I'm really putting in a lot of effort to hear this. But spoken language should not be difficult to hear. What we do know is that when you get into situations where there's a lot of people talking and there's complex situations, more than one conversation going on, that does become difficult even for people with normal hearing sometimes. So there have been times I go into restaurants or at a party or something like that, and I'm trying to talk to somebody, and there's other sounds going on around me, there's music. Even though I have normal hearing, it is difficult for me to hear sometimes as well. So know that you're not the only one struggling sometimes when you go into those situations. So if you have hearing aids and you're struggling, sometimes it's a good thing to ask somebody around you, are you having trouble hearing here? Because sometimes it's not just you. But that's when it becomes difficult. And if you do have hearing loss, that's when you really need hearing aids or technology that's really going to do its best job of helping, again, to orient your brain, support your brain in that environment. So just keep that in mind. One-on-one conversation shouldn't be that difficult. And we want that to be effortless. When you get into a difficult situation, sometimes you need technology that can really do a better job of helping your brain, support your brain in that situation. So again, we really take this hearing loss really seriously as audiologists. So when audiologists are making a recommendation to you to aid your hearing loss and give you recommendations for hearing aids, it is because there are all of these risk factors that we know about, and these studies that we know can link to or possibly lead to other health risks or other things long-term that could be prevented. So it's really important to just know where your hearing loss is, do your annual checks on your hearing loss. And if you have a hearing loss, to wear hearing aids. Also just, knowing if you're here thinking about a loved one, letting them know that there are some options out there that could possibly help them. So we don't want anyone to feel like they have to withdraw. It is going to take some effort to hear in these challenging situations, but hearing aids typically can improve that and make it cause much less effort to hear in those environments. Okay, again, thinking about that effortless versus challenging. So once, if you're in a one-on-one conversation like this right now, hopefully you can hear me really well. It's quiet. There's no one else talking. You're focusing on my voice. You're probably not putting a lot of effort in that. But when you go into, and that's what we want conversations to be like. When you go into a more challenging situation where there's a lot of people talking, there's music, your brain has to put some effort in. So with a hearing loss, sometimes it starts to feel like it's too much work and you just want to give up. And that's very typical. Like I said, sometimes with the normal hearing, that's very typical as well when you go into these environments, but it's much more of a problem when you do have a hearing loss. If you go into these places, usually people just say, oh, this is too hard. I can't do it. So just a little game we're going to play here, and you don't have to respond here, but I'm going to put some things up on the slide. And this is going to use another sense, not your hearing, but your sight. So I just want you to read these. You don't have to say them out loud, just read them, and I'm going to skip through them pretty quickly. Just read these words. Okay, so that's the last one. So did it feel like that you needed a little bit more time as you got further down, as I started to click through the last 4 or 5 slides? Did it feel like you needed a little more time looking at them? The first few were pretty easy. You could read those really quickly. But as I got through and those kind of gotten a little more jumbled up, you probably still got the word eventually, but your brain had to put a little bit more effort into that. And that's really kind of the same as when we think about being in situations where there's a noisy environment and you're trying to understand speech with your ears instead of your eyes. When there's a hearing loss, the brain really has to work harder to make sense of that sound because it's being received in a different form. So your brain's getting this information through a broken system, essentially. So somewhere in there in that little, if you go back to that brain picture I was showing you, something's not working well to get the sound up to where it needs to. The brain is getting mixed signals, essentially. It's not getting what it used to get. So your brain really has to put a lot more effort into it. And it takes time. So that's just a little way to kind of think of that in a different way. So there's 3 different really things we kind of think about. You have to put in some listening effort, you have to focus, concentration, all of these things that are under your control essentially when you're listening. So these are things that you control, how much you're focusing, how much concentration you're putting on the conversation. If it's something interesting, maybe you're going to put more attention to it, or you're going to put more effort into it. But essentially you kind of decide how much energy you're willing to put into that. If it's something that you want to hear, you put more energy into it. But if you have a hearing loss and you go into a situation, at some point there's a breaking point where you say, I'm putting too much effort in, I'm too tired to listen to this or invest my time and my energy into this. So a lot of times people, when they are explaining how they feel when they have a hearing loss, they say, it becomes too difficult. They maybe will just kind of answer in a way like, oh, they understood, but you've probably been in a situation where you thought you understood what the person was saying, or maybe part of the sentence, and you kind of gave up. So you acted like you understood, but you really didn't. And that's really what happens when you have hearing loss. At some point, you kind of give up because it's too hard to hear, and it makes it really difficult. So if I put up more slides and jumbled up the words even more, sometimes you might get to a point where I don't even know what words you're trying to put there. So that's essentially kind of the things you have control over, but it becomes really difficult when you have a hearing loss. Yeah. I just want to stay there for a minute. Not sure what you guys are seeing here. So we're looking at some common signs that you have hearing difficulty, or you may experience this. You may know someone that has said something like this. Okay. So have you ever heard, or have you ever told somebody that people are mumbling? That, if maybe they wouldn't mumble, I would hear a little bit better. My mom says this to me all the time, and I'm probably guilty of doing that sometimes to my mom. But as an audiologist, I've heard this a lot. And that's typically a sign sometimes, is that you feel like maybe a lot of people are mumbling. You may have one person that does that a lot, but if you notice that with multiple people, and that you're having trouble in crowds, that may be a sign that there may be some hearing loss there. Another one is that it may be harder to follow a conversation in meetings or a noisy restaurant. So we talked about. So sometimes, it happens so gradually that it's hard to notice that. But if you're going to places, I know it's been a time in the world where we're not going out in a lot of groups and noisy places. But if you are in those situations and you find that it's harder to follow and you're asking others, are you having trouble? Did you understand what she said or he said? That might be a sign as well. And then another one is limiting social activities because you feel like it's going to be difficult. If you've ever avoided a place or an activity because you felt like it was going to be hard to hear, that's something we don't want. So that may be a sign that, you have a hearing loss, and hearing aids may help you in that situation. So again, overall, the hearing loss affects the overall hearing process. And when your brain doesn't receive the correct details of sound, there are many problems that may occur. So we want to make sure that these things are not happening. So your brain's receiving less information. When you're getting that signal that's broken, your brain's not getting the information it needs to. So it's not getting the information it got when you didn't have a hearing loss. So I always kind of say use it or lose it kind of thing. If your brain's not getting activated, it's not really working to its best potential. And I'm sure you've had people tell you, it's good to keep your brain active and read and do crossword puzzles. It's the same with a hearing loss. If your brain's not getting a signal in that auditory cortex, that's not really good for your brain and brain health. So when you don't receive that information to your brain, it makes it harder to recognize the sounds in your environment. Again, feeling that you're not hearing well in those difficult listening situations. You maybe feel like you're having to guess at what people are saying, or that you're really concentrating and put a lot of effort into what you're hearing. And then there have been a lot of studies that show that extra effort leaves less mental ability, less brain ability to help remember your conversation. So if you're able to put in less effort, and you can typically, you're able to remember a little bit better. So with the hearing aids that we fit, a lot of times that is something that's really important. There's been studies to show that they give you the ability to put less effort into your listening, therefore you can remember more about what you're hearing. So that's also really important to that brain health and overall hearing health care as well. Okay, so again, thinking back to brain hearing. Brain hearing and the technologies that are in many hearing aids, specifically Oticon is the company that I work for. We really focus on research to make our hearing aids brain friendly. Brain hearing is always our goal. So we want to preserve really good function to the brain, get the brain the cleanest signal that we can so that you can orient and focus on the things that you want to in your environment. I think that's always something to remember. If you've worn hearing aids, if you've looked at hearing aids, not all hearing aids are created equal. There's a lot of research that supports technologies, and some hearing aids do a really good job doing research and putting technologies out that really help support your cognitive function. So you want to have a hearing aid that's going to do a really good job at giving your brain a signal that's going to be clean and clear and help you get information to those sounds all around you so you can support your brain's natural ability and your cognitive function overall. So again, back to brain hearing, we always think about the brain when we're thinking about technologies that's going to work best for your hearing loss. So again, not sure how many people here have hearing aids or wear hearing aids or the brand of hearing aid that you wear. But just know that with all hearing aids and the options that your audiologists are recommending for you, there's a solution for every type of maybe lifestyle that you're in, the places that you're going, the things that are important to you. And that's something to really talk to the audiologist about, because that's really going to play a big role into what they're recommending. And it's not just where you have difficulty, because we do want to know that, but it's the things maybe you stopped doing that you used to do. There are hearing aids that can really help you get back into those environments that you've missed out on. So there's really a solution for all lifestyles or all things that you want to do. It's just kind of talking to your audiologist about what's important to you and making sure that it's something that's, they're going to pick out something that's going to work for you together with you. So going back to this picture, this really kind of, you probably, if you have hearing loss, or if you don't, this can kind of give you an illustration of what that may be like. So untreated hearing loss kind of feels like this picture. So it really makes it difficult to follow conversations, engage in conversations, especially if there's multiple people talking. So this is a typical probably dinner, you may have experienced at Thanksgiving, or you may experience over the holidays with families. When you're around those people and your loved ones and friends and family, you want to hear them and you're close to them. But this, if you see that they're, this blurred out image can make you feel a little bit isolated, because they're around you, they're having conversations around you, but maybe you're not understanding those, or you're feeling a little left out of the conversation if you're missing those around you. So what a lot of hearing aids can do, so if you wear hearing aids before, if you've worn hearing aids before, or tried hearing aids, or have heard about hearing aids, a lot of hearing aids will focus on a person in front of you really well. And that makes it easy to hear the person in front of you. But as you can see at this table, there's a lot of other people around. So he may be listening to that, his son or someone right across from him, but may be missing out on conversations around him, because some hearing aids don't do as good of a job of getting the information all around. And again, we want your brain to get that orient in the entire sound scene and the environment around you. So it's really important that you have access to the other people as well. So now there's technology out there that can really help you be able to hear the speech from all directions. And so that's something really important to discuss with your audiologist when you talk to them about, what environments you're in, what you're missing. Because if you're in a situation like this, we don't just want you to hear one person, we want you to have access to everything. And we want your brain to be able to orient around you and focus on what you want to focus on, and not let the hearing aid just focus on what it wants to. So if you wear hearing aids and you've struggled in this situation, it may be that you have older technology or technology that wasn't able to do that, because this technology, as you know, changes very quickly and is just getting better and better with hearing aids specifically. So now there is technology that can really help improve where you're hearing speech around you in these environments. So again, just thinking back to where he was in that blurred image to having technology that can really help this open up the sound scene and make it more natural and support his brain in a natural way, so he's able to hear all the loved ones around him at the table. So again, remembering back to the brain is really that processor of sounds. We want to make sure that the technology you're using is really using research and technology that can help support that it's getting the information. The sound it's not always about making it louder. So again, if we are hearing aids, the sound does need to be louder for you to hear it, and that's how we set the hearing aids. But what the hearing aid is doing to help support your brain in that process is really important, because we do want to remember and focus on that we want the brain to have all the information so that it can be work to its best ability and improve that brain health over time. And again, going back to hearing with less effort. So a lot of the research that Oticon has done has really shown that with this new technology, supporting the brain really helps you put less effort into your hearing and your experiences. Therefore, you can remember more, you can be less tired at the end of the day. I'm sure if you've worn hearing aids or have hearing loss, you know how tired you can be at the end of maybe a meeting or just a day of communicating, because it does cause you to put a lot more effort into listening throughout the day, and it can be really exhausting. So anything that we can do to help decrease that effort and help you possibly remember more and understand better. So again, understanding speech better helps give you less effort in those environments, and you can remember more conversations. And I'm sure, if you are interested, there's a lot of studies that we can show you, and audiologists can go through with you that does show that there's been some studies that do improve your memory whenever you're wearing these hearing aids. So I think that's really important to, again, think back to how we're supporting your brain there. So another thing to think about is, again, when you're coming in and you're talking to an audiologist, we really want to make sure you're taking your personal preferences into account. And that's something that we do with Oticon hearing aids specifically. So you're able to do some testing in the beginning that can really help set the hearing aids up for not only your hearing loss, but your preferences for sound. Because if you're listening to something and your neighbor's listening to something and someone in the other room's listening to that saying something, you're all going to want to hear it a little bit differently, because we all have different preferences for the way we want to listen to things. And so that's something that's really important when you're thinking about getting a hearing aid and having it fit, is working really closely with your audiologist to make sure that you're telling them how you like to hear. And there's some ways that they can do that in the software with the hearing aids to help set that up in the beginning. So connectivity may be something that you are aware of with hearing aids. Maybe you have hearing aids that connect to your devices as well. So most hearing aids now can be connected to your smartphones, so that you're able to stream music. You can stream phone calls through your smartphones, and that's something to just know that there's a lot of options out there with iPhone and Android devices. So if you have a smartphone and you want to be able to call loved ones and stream directly to your hearing aids, that's a really nice feature with hearing aids now as well. You can also listen to music, podcasts, watch Netflix, watch things on your phone or your iPad as well through your hearing aids. There are some other connectivity options that go along with our hearing aids as well. So there are devices where you can connect them directly to your television, which then streams the signal directly to your ear. So it's almost like your own listening set wirelessly to your TV. So you can control your volume, and your loved ones in the room don't have to listen to the same volume. They can listen at their comfort level, and you can listen at yours when you have something like that. You can connect to computers. There are remote control options. Now there are remote control options just on your smartphone. So a lot of ways that you can really be connected to the world around you with these devices, and also have a little bit more control over your hearing aids as well. Now hearing aids have a nice lithium ion rechargeable option with hearing aids, so you don't have to bother so much with batteries these days. So changing them every week or every few days. Now you can just put the hearing aids in chargers at night, and they will charge overnight and be ready for the next day. So I think that's a really nice convenience feature that we've added over the last few years, of being able to just quickly, you charge your phone, you charge other things. Now you can just charge your hearing aids at night and they're ready to go. Another nice option that is new, maybe if you haven't had hearing aids recently, or haven't gone to have your hearing checked or seen your audiologist recently, are options for remote care. So as you know, when we were kind of stuck at home for a while last year, there may have been times when you couldn't get in to see a doctor or a physician, or go into a healthcare appointment. Now, if you have the ability to connect to your phone, your audiologist can do a remote appointment with you and help adjust your hearing aids from home. So if there are little things that need to be adjusted once you've been fit in the office, there are ways that you can do this over the phone and remotely. And that's something that's nice to consider for the future as well. So just to go over what we kind of talked about again, improving speech understanding is really our goal at Oticon and with hearing aids. And when you come in to see your audiologist, that's their goal, because typically most people, when they come in and they have hearing loss, it's the things that they are complaining of, or the things you may notice when you're in the world around you, is understanding speech. We want you to hear all the things around you, and that's really important. But our main goal is making sure that you can communicate better with the people around you, and make that less effortless, and put less effort into understanding those around you, and improve that for you and in your quality of life and communication with those around you. And then also overall, just when you're fit with a hearing aid that can do that and help you in those environments, really giving you the motivation to go back out into the world, experience things that maybe you've stepped back from, hearing loved ones around you. I've fit a lot of patients throughout the time I've been fitting hearing aids that, they kind of got complacent in what they were doing and just said, I'm okay just staying at home and watching TV. But when they got their hearing aids and went back out, they remembered what they missed. They remembered, seeing friends around them, going to dinners. And it was just a part of their world that they kind of just thought they wouldn't get back. So I think it's something to just remember, or if you know loved ones that seem to be experiencing this, that there are some really good options to help in these situations where you're struggling now. So, remembering again, the reason we're kind of doing this presentation today is to encourage you, if you haven't gotten a hearing test in a long time, to you're here, you're listening, come in and get a hearing test. If you have a loved one that you feel like is struggling, encourage them to come in and get a diagnosis and just see, is their hearing normal? Is there maybe something we need to be watching or monitoring, or possibly even demo a set of hearing aids and see if it's something that may help them. Because again, it's not just that we're here as audiologists to test your hearing and put a hearing aid on, but really looking at the bigger picture of what aiding this hearing loss can do to help your overall health care and long-term brain function as well. So if you haven't gotten a hearing aid or a hearing test yet, scheduling your appointment is really important. So this next slide, I'm going to put up their information at UNCG so you guys can call and make appointments. If you've had a hearing aid test before, but it's been a while, hearing loss can change. So that's something that we really recommend, typically like an annual hearing test. at least, or whenever you notice changes. So sometimes, it's not always just every year it could change, but there can be changes within that time frame. So if you notice any changes, it's always a good idea to come in and just have it checked as well, because if you have hearing aids, there may be some adjustments that need to be made that can improve the function, or also listing just the new options for technology. And then discussing your treatment options with your audiologist, again, going into what is important to you and personalizing it to your needs. So thanks for your time, and I hope that all was very useful information, and I can take questions. I'm going to put up the information for UNCG for their hearing and speech center, the phone number and the email address, and something that's always really nice when I go there is noticing that they do have really easy parking to get to. So they have a place you can park and walk right across the little parking lot to go into the building. So easy place to get into and get your hearing tested. Are there any questions? If you want to unmute your mic, you may ask, and I can go back to anything if there are.
Well, at the beginning, I forgot to introduce our fourth-year doctoral students that we have. We're committed to lifelong learning here at the UNC Greensboro Speech and Hearing Center. And so anytime that you come in to see us, you'll usually be seen by an audiologist and one of our fourth-year doctoral interns. We have Heather Serrano and Sarah Conrad, who are two doctoral interns who are here with us through this year. And then when they graduate, they will be clinicians and go out into the community to help on their own. So we're glad to have them with us, and we look forward to answering any questions that you have or speaking with you if you have any hearing needs that we can help you with.
I don't know if I can see the chat or not. Jennifer, can you see the chat box? One's not coming up on my screen for some reason. If there are any questions. Wait, I do see one. Keep asking masking tinnitus with a hearing aid. So talking about that. I don't know if Lisa's still on, but she's a good one to ask. She maybe looks like maybe she jumped off, right? Mm-hmm. I can answer a little bit, and Jennifer, you can also chime in as well. So Keith was asking about tinnitus maskers and hearing aids. Most hearing aids these days that you get will have an option for tinnitus, a tinnitus program. So if tinnitus is something you're experiencing, luckily Dr. Fox Thomas there is a very good tinnitus expert to consult with. So if you have questions, she's definitely someone you want to talk to. But oh, sorry, my screen's jumping off on me. I don't know if you guys can still see my screen. Okay. But Oticon hearing aids specifically, I can speak to, do have a tinnitus program. So your audiologist would add that in. And then there's some different white noises, different noises or maskers that you can use depending on where your tinnitus is. So the audiologist would help determine what frequencies your tinnitus is at, or where, what may be the best option for you to choose, and then give you those options to listen to. There are also some really good apps you can kind of download sometimes that can help. You can mask tinnitus with some different sound options. But most hearing aids do have an option where you would get another program. You would just switch to that program, and then you can either listen to the masker while your hearing aids are on, or you can kind of turn your hearing aids off and just turn them into a masker. Does that help answer your question? Another thing I'll add is that sometimes if you're experiencing tinnitus, that is a byproduct of hearing loss as well. So sometimes when you have a hearing loss, tinnitus is something you will hear also. So sometimes just aiding your hearing loss. So if you haven't worn hearing aids, or if your hearing aids are older, just putting hearing aids on that do a good job of, again, supporting your brain and giving your brain that information that it's missing can help reduce the tinnitus. So help the tinnitus not be as noticeable. So some people, as soon as they put the hearing aids on, they get a lot of relief from their tinnitus without a masker.
Yes, I agree with everything you said.
Any other questions?
I was going to say for attendance evaluation, there are several things that we can do to help us evaluate how what might be the best solution for you. But listening to devices or having an option for that. Having maskers are included in most devices, so that is an option if needed. Yeah.
Any other questions for me, or and I can always answer questions as well anytime. If you have questions for me, they can send them to me. Thank you guys for joining us, and I hope if you hope you get a chance to listen to hearing aids again. I just encourage everyone that if you've had an experience, you've listened to hearing aids, and maybe it wasn't the time then, there are always changes with technology, and going in and just doing a demo on devices. There have been a lot of people that say, I wish I wouldn't have waited this long. So, and again, just taking care of that overall hearing and throughout the time, and the healthcare too. So making sure you're just monitoring your hearing as well, because it can change.
Well, thank you all for joining us. If you are interested in taking a listen to Oticon devices, we have some demo devices here in the clinic. We're also happy to answer any questions that you might have about hearing in general, or you're welcome to call our office. The number is 336-334-5939 if you're interested in scheduling an appointment with us.
All right. Well, thank you guys for having me. I appreciate it.
Thank you so much for joining us today, Dr. McCall.
Okay. Have a good rest of your day.
Thank you. You too.
Bye.